Let us now learn about posterior triangle of neck. Posterior triangle of neck is a triangular space on side of neck behind sternocleidomastoid. You can see it is triangular space. It is present on side of neck behind sternocleidomastoid. Boundaries of posterior triangle. Anteriorly, posterior border of sternocleidomastoid. This is anterior boundary. It is formed by posterior border of sternocleidomastoid. Posteriorly, anterior border of trapezius. You can see posteriorly anterior border of trapezius. Apex, it is formed by meeting point of sternocleidomastoid and trapezius at superior nuchal line of the occipital bone. Meeting point of sternocleidomastoid and trapezius at superior nuchal line of occipital bone. Base, it is formed by superior aspect of middle one third of clavicle. Anteriorly, posterior border of sternocleidomastoid, posteriorly anterior border of trapezius, base, superior aspect of middle one third of clavicle, apex, meeting point of sternocleidomastoid and trapezius at superior nuchal line of the occipital bone. Floor of posterior triangle. The floor of posterior triangle is muscular. Muscles forming the floor from above downwards are semispinalis capitis, sometimes splenius capitis. This is splenius capitis, levator scapulae, scalenus medius, and scalenus posterior. Remember 4S and 1L. Semispinalis capitis, splenius capitis, levator scapulae, scalenus medius, scalenus posterior. Roof is formed by investing layer of deep cervical fascia stretching between sternocleidomastoid and trapezius. You can see the roof is formed by investing layer of deep cervical fascia stretching between sternocleidomastoid and trapezius. Over the roof, superficial fascia is present. Superficial fascia overlying the roof contains platysma, external jugular vein, posterior jugular veins, cutaneous nerves and vessels. Platysma, external jugular vein, posterior jugular veins, cutaneous nerves and vessels. You can see platysma, external jugular vein, posterior jugular vein, cutaneous nerves and vessels. Structures piercing the roof are four cutaneous nerves of cervical plexus and external jugular vein. You can see external jugular vein and four cutaneous branches of cervical plexus. Subdivisions of posterior triangle of neck. Posterior triangle is divided into two parts by inferior belly of omohyoid. Omohyoid has two bellies, superior belly and inferior belly. Out of the two bellies, inferior belly of omohyoid subdivides the posterior triangle into two triangles. Upper larger occipital triangle, lower smaller subclavian triangle. You can see upper triangle is larger triangle, that is occipital triangle. Lower triangle is smaller, it is subclavian triangle. Subclavian triangle is also known as supraclavicular triangle. Contents in the occipital triangle. Arteries, veins, nerves, lymph nodes. Arteries. Occipital artery, transverse cervical artery. Veins. Transverse cervical vein. Occipital artery, transverse cervical artery. Occipital artery is a branch of external carotid artery. It crosses the apex of the posterior triangle superficial to semispinalis capitis. Transverse cervical artery. It is a branch of thyrocervical trunk. Transverse cervical artery arises from thyrocervical trunk. Thyrocervical trunk is a branch of first part of subclavian artery. First part of subclavian artery gives thyrocervical trunk. Thyrocervical trunk gives three branches. Suprascapular artery, suprascapular artery, inferior thyroid artery. Inferior thyroid artery supplies thyroid gland. It also gives transverse cervical artery. Transverse cervical artery. Transverse cervical artery is a branch of thyrocervical trunk. Transverse cervical artery divides into superficial branch and deep branch at the lower border of levator scapulae. This is levator scapulae. At the lower border of levator scapulae, transverse cervical artery is dividing into superficial and deep branches. Superficial branch of transverse cervical artery is called superficial transverse cervical artery. Deep branch of transverse cervical artery is called dorsal scapular artery. Veins. Transverse cervical vein. Transverse cervical vein accompanies transverse cervical artery. Transverse cervical vein crosses superficial to scalenus medius. It drains into external jugular vein. Next nerves. Four nerves. Spinal accessory nerve, C3 and C4 fibers, four cutaneous branches of cervical plexus, dorsal scapular nerve. Spinal accessory nerve, C3 C4 fibers, four cutaneous branches of cervical plexus, dorsal scapular nerve. Spinal accessory nerve. Spinal accessory nerve pierces anterior border of sternocleidomastoid, passes through the muscle substance, pierces the posterior border of the sternocleidomastoid, and emerges about the middle of posterior border of sternocleidomastoid. Here it is related to some upper deep cervical lymph nodes. It then passes downwards and laterally, parallel to the fibers of levator scapulae, and disappears by passing underneath the anterior border of trapezius. It supplies sternocleidomastoid and trapezius. Spinal accessory nerve passes just below the roof of the triangle. C3 C4 fibers. Muscular branches of C3 C4 roots to levator scapulae and trapezius. Muscular branches of C3 C4 roots to levator scapulae and trapezius. They appear about the middle of posterior border of sternocleidomastoid. The branches supplying the levator scapulae soon end in it, while the branches supplying the trapezius runs below and parallel to spinal accessory nerve, crossing the middle of the triangle. Four cutaneous branches of cervical plexus. They emerge at middle or just above the middle of the posterior border of the sternocleidomastoid. They pierce the roof of the posterior triangle of the neck. The four cutaneous branches are lesser occipital nerve, great auricular nerve, transverse cervical nerve, supraclavicular nerve. Remember the names in this way? It is occipital region. Occipital. It supplies lesser part of the auricle. Lesser occipital nerve. Great auricular nerve. It supplies greater portion of the auricle. Great auricular nerve. It is going transversely. Transverse cervical nerve. It is going towards the clavicle. It passes in front of the clavicle. Supraclavicular nerve. Lesser occipital nerve. It arises from ventral ramus of C2 spinal segment. Lesser occipital nerve. It passes upwards along the posterior border of the sternocleidomastoid and supplies the skin of upper one-third of medial surface of the auricle and adjoining part of the skull. Great auricular nerve. It arises from ventral rami of C2 C3 nerves. Great auricular nerve passes forwards and upwards across the sternocleidomastoid towards the angle of the mandible, where it divides into anterior and posterior divisions. Great auricular nerve supplies the skin of the face over the angle of the mandible, skin over the parotid gland, and lower part of both the surfaces of the auricle. Transverse cervical nerve. It arises from ventral rami of C2 C, same as that of great auricular nerve. Transverse cervical nerve. It runs transversely across the sternocleidomastoid and divides into ascending and descending branches. It supplies the skin over neck. Supraclavicular nerve. It arises from ventral rami of C3 C4 nerves. It passes downwards and divides into three branches: medial supraclavicular nerve, intermediate supraclavicular nerve, lateral supraclavicular nerve. Medial supraclavicular nerve supplies the skin over manubrium till manubriosternal joint. Intermediate supraclavicular nerve supplies the skin of first intercostal space. Lateral supraclavicular nerve supplies the skin over upper half of the deltoid muscle. C2, C3, C4. C2 lesser occipital. C2, C3 great auricular, transverse cervical. C3, C4 supraclavicular nerve. Dorsal scapular nerve. It is from C5 root. It pierces scalenus medius. It passes deep to levator scapulae to reach the back. Lymph nodes, occipital lymph nodes. Now let's revise the contents in the occipital triangle. Two arteries, occipital artery, transverse cervical artery. Veins, 1 vein, transverse cervical vein. Nerves, 4 nerves, spinal accessory nerve, C3, C4 fibers, 4 cutaneous branches of cervical plexus, dorsal scapular nerve. Lymph nodes, occipital lymph nodes and lymph nodes along spinal accessory nerve, lymph nodes along posterior border of the sternocleidomastoid. Now let's see the contents in the subclavian triangle. Contents in subclavian triangle: arteries, veins, nerves, lymph nodes. Arteries. Third part of subclavian artery. Suprascapular artery. Transverse cervical artery. Veins. Transverse cervical vein. Lower part of external jugular vein. Subclavian vein. Third part of subclavian artery. Suprascapular artery. Transverse cervical artery. Transverse cervical artery, it is present in occipital triangle and also in subclavian triangle. Veins. Transverse cervical vein, lower part of external jugular vein, subclavian vein. Transverse cervical vein, it is present in occipital triangle and also in subclavian triangle. Transverse cervical vein drains into external jugular vein. Terminal part of external jugular vein. External jugular vein pierces the roof of the posterior triangle and terminates into subclavian vein. Subclavian artery, it is present behind scalenus anterior over the first rib. Subclavian vein, it is present in front of scalenus anterior over the first rib. Transverse cervical artery and suprascapular arteries are branches of thyrocervical trunk which arises from first part of the subclavian artery. Subclavian artery, it passes behind scalenus anterior over the first rib. Subclavian vein, it passes in front of scalenus anterior over the first rib. Suprascapular artery, it is a branch of thyrocervical trunk. Transverse cervical artery, it is also a branch of thyrocervical trunk. Veins. Transverse cervical vein, it drains into external jugular vein. Lower part of external jugular vein. The terminal part of external jugular vein pierces the roof of the posterior triangle and drains into subclavian vein. Nerves. Roots and trunks of brachial plexus. Nerve to serratus anterior. Nerve to serratus anterior is also known as long thoracic nerve. It arises from roots of brachial plexus. C5, C6, C7 roots of brachial plexus. Nerve to subclavius and suprascapular nerve arises from upper trunk of brachial plexus. C5, C6. You can see the roots and trunks of brachial plexus in the subclavian triangle. From the upper trunk of the brachial plexus, suprascapular nerve to subclavius arises. Trunks of brachial plexus emerge between scalenus anterior and scalenus medius. Lymph nodes, supraclavicular lymph nodes. Supraclavicular lymph nodes lie superficial to subclavian vessels and brachial plexus. Let's revise the contents in the subclavian triangle. Arteries. Transverse cervical artery, third part of subclavian artery, suprascapular artery. Veins. Transverse cervical vein, lower part of external jugular vein, subclavian vein. Nerves. Roots and trunks of brachial plexus. Nerve to serratus anterior or long thoracic nerve. Suprascapular nerve. Nerve to subclavius. Supraclavicular lymph nodes. Now let's revise posterior triangle of neck. Boundaries. Anterior boundary, posterior border of sternocleidomastoid. Posteriorly, anterior border of trapezius. Apex meeting point of sternocleidomastoid and trapezius at superior nuchal line of occipital bone. Base, superior aspect of middle one-third of the clavicle. Roof, investing layer of deep cervical fascia. Floor, the muscles forming the floor from above downwards are semispinalis capitis, sometimes splenius capitis, levator scapulae, scalenus medius, scalenus posterior. Subdivisions, it is subdivided into occipital triangle and subclavian triangle by inferior belly of omohyoid. Contents, contents in the occipital triangle: arteries, occipital artery, transverse cervical artery. Veins, transverse cervical vein. Nerves, 4 nerves, spinal accessory nerve, C3, C4 fibers, 4 cutaneous branches of cervical plexus, dorsal scapular nerve. Lymph nodes, occipital lymph nodes. Contents in the subclavian triangle: arteries, third part of subclavian artery, transverse cervical artery, suprascapular artery. Veins, transverse cervical vein, lower part of external jugular vein, subclavian vein. Nerves, roots and trunks of brachial plexus. From the roots of brachial plexus, nerve to serratus anterior or long thoracic nerve. From the upper trunk of the brachial plexus, suprascapular nerve, nerve to subclavius. Lymph nodes, supraclavicular lymph nodes.